Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. Welcome to Monday Health Minutes with Valley Health. Pre-exposure prophylaxis, or PrEP, has emerged as a vital tool in the fight against HIV and AIDS, offering a preventative option for individuals who could be at high risk of contracting the disease. So today we're talking with Wellman, the Chief Community Health Officer at Valley Health, about what PrEP is and how it works. Thanks for being here.
Yeah, thanks for having me.
Let's talk about what exactly PrEP is and who does it work for.
So PrEP is a once-a-day medication. In most cases, it's a pill that you take once daily in order to reduce the likelihood of transmission of HIV in an HIV-negative person. So we focus on the individual, make sure that that person doesn't have HIV, and then the medication is a great option for that person to take once a day, particularly depending on lifestyle, sexual activity. Those increase the risk. There's a number of other social factors that can influence that risk, but really it's all about making sure that we help in that individual reduce as much as possible the likelihood that they would acquire HIV.
Can you explain to me how the medicine helps to do that?
Yeah, so the medicine is what's known as an ART, an antiretroviral therapy. Again, it's a once daily oral medicine. There is also more recently in recent past anyway, what's known as an injectable version. And so that medicine is, for the first couple of months, you get a once a month injection, then it's an every 2-month process. So normally anyone who is a licensed prescriber can prescribe these medications. So it doesn't require any type of special certification. It does require a little bit of understanding of the medication, and really that personal preference as a provider to be able to incorporate that into the office visit and really help individuals who may not even know about the medicine. These medications are what's known as grade A recommendations from the U.S. Preventive Services Task Force. So it's a high recommendation, the same as a recommendation for a colonoscopy or blood pressure screening. So it's a really important part of that interaction, especially in our family medicine offices.
Who should be considering this? What kind of lifestyle? We mentioned that, depending upon their lifestyle. So go into that.
Yeah, so there are those that are high risk, particularly if you talk about individuals who are not in maybe a monogamous relationship, who have multiple partners, who may not use protection. Again, protection such as condoms, barrier protection is very important, but it is not as effective as PrEP as far as preventing HIV. A person on daily PrEP can reduce their likelihood of transmission of HIV by up to 99%. So it's extremely effective as long as the individual's taking the medicine on a daily basis as part of their daily medicine regimen and routine. It's highly effective at preventing HIV.
Are there any side effects to the medication?
So there are an occasional side effects. The most common, and it's a very small percent, GI symptoms, upset stomach, nausea, dizziness, headache, similar warnings with a lot of medications. So the important thing is to recognize if you feel like you're experiencing symptoms, if you're on daily PrEP, and have that conversation with your healthcare provider. If you're on PrEP, you should be seen every 3 months. The process to get started is easy. You have a physical exam with your healthcare provider, you get some blood work done, you make certain that you're not HIV positive. It's kind of a hallmark prior to starting the medicine. And then once you're started on it, the medicine, you're generally followed about every 3 months. And there's repeat lab work, follow-up lab work, additional screenings that we do to make sure that your health metrics are okay.
Any final thoughts about PrEP?
Yeah, absolutely. I think the important part here is really twofold. One is highlighting within the medical community, within the provider, that interaction in the exam room with your patients, to really focus on sexual health, preventive measures, the ability to have that discussion about PrEP and the importance of the effectiveness of the medicine. And sometimes I think that gets overlooked. We do know through data that the prevalence of HIV is highest in those under 34. I think there's a 56% higher chance of acquiring HIV in the adolescent through 34-year-olds. So we know a higher prevalence population, and we really want to be able to focus in any sexually active person to be able to have the discussion, feel comfortable with the discussion, provide information, and give a really extremely effective option of HIV prevention to our patients.
It's some great information to pass along. These conversations do need to happen. Brett, thank you so much for all the advice. Thanks so much for checking in with Monday Health Minutes.